My first guest is Darin Sutton, Dr. Darin Sutton to be exact, and he is with Carolina Bays ENT and Audiology. And we thank you very much for sponsoring the closed caption portion of our show, and welcome to you.
Thanks for inviting us.
Tell me a little bit about your practice, the types of things that you treat, and where you're located.
Well, we're located near Conway Medical Center off of Singleton Ridge Road, and the type of practice we have is pretty much a general ENT practice where we cover all the stuff that an ENT would normally cover, including ears, nose, of course, and sinuses, as well as the throat, and tonsils, thyroids, facial skin cancers, and facial plastics.
Speaking of tonsils, let me just ask you something. Is it true that they don't really worry about tonsils like they used to when I was a kid?
The number of surgical procedures certainly have gone down since when you were a child 10 years ago.
And why is that, Darin? 10 years ago, I like that.
It's the idea of the reason for doing the tonsillectomies. It used to be that in times past, if one child in the family got strep throat, they considered all of them to be carriers, and so everyone got it. Now there's a different criteria for doing tonsillectomies. There are certain numbers of infections that are needed to reach that the need for a tonsillectomy, such as 6 infections in a year, or 5 infections per year for 2 years, or 3 infections per year for 3 years. But the most common reason why we do tonsillectomies in this day is for the upper airway obstruction or obstructive sleep apnea that occurs in childhood.
Let's talk about something really new in your field, and that's sinusplasty, balloon sinusplasty. And before we get into that, who qualifies? Who is someone who would be a great candidate for balloon sinusplasty?
Patients who have CT diagnostic evidence of chronic sinusitis are typically the patients best for this balloon sinuplasty device. And that doesn't necessarily mean that all patients coming into the office who have symptoms of sinusitis have sinusitis. Really, you need CT documentation to actually give you the criteria for proceeding with that.
So it's sinuplasty, not sinusplasty? It's
It's sinuplasty.
Tell me more about the actual procedure. Is it much like the angioplasty where the...
Very, very similar. It is a catheter device that's inserted into the sinus cavity. As done in the traditional or conventional way of doing endoscopic sinus surgery, it uses a guide catheter to slide the device up into the natural opening of the sinus. It uses a guide wire. The guide wire can be either inserted by 2 techniques. One is using an X-ray technique called the C-arm fluoroscopy, where you can follow the guide wire up into the sinus, and then you can slide the balloon over the top of the guide wire and inflate it into the natural ostium of the sinus. The second way, which is a newer device, uses an illumination. You can actually pick up the light coming through the skin in the maxillary sinus or into the frontal sinus, and it tells you that you're in the sinus. Then you slide the catheter in there and dilate the balloon. So
are you really doing this, Darin, just to help the patient breathe better? Are you basically cleaning out the nasal passages?
Well, the reason why people get chronic sinusitis is primarily because of an obstruction problem, either anatomically or physically, in that their allergies have caused an obstruction of the sinus or polyps or so forth. And so we're doing the technique to alleviate the obstruction. If you alleviate the obstruction, it allows the sinus to drain, it brings back the normal function of the sinus to clear out itself, because the obstruction is the primary reason they develop the chronic sinusitis.
Tell me a little bit more about the surgery. I know you've got some pictures to show me.
Basically what we do is we use an endoscope. It's on a monitor. We slide the guide catheter into the particular position for opening up that particular sinus. And using, like I said, the C-arm fluoroscopy or the illumination, we slide the guide wire up into the sinus, like in this instance into the frontal sinus, and then we slide the catheter over the top of the guide wire. There's a balloon on that catheter. We inflate the balloon under specific atmospheric pressures. Once we've dilated that ostium, it allows the sinus to drain, or we can then also insert an irrigation device over the guide wire as well and irrigate out that sinus.
I would think, with this being one of the #1 areas in the entire country for allergy-prone diseases, that this is really kind of magic for sinus sufferers.
It is very, very easy to do as compared to traditional sinus surgery, in that it's safer. It allows you to get into the sinus without risking other structures around the sinuses, in a more easier technique so to speak, than the removing of bone and tissue that is required with the traditional type of sinus surgery.
Pretty much outpatient surgery with how much recovery?
Outpatient surgery, some recovery times as short as 24 hours.
And then what can a person expect who has this done other than breathing better?
Statistically speaking, 80% of patients have maintained open osteums or open sinus drainage ports as far out as a year and a half out of surgery, which is significantly improved over conventional techniques where excessive scarring can occur.
Sounds great. And wrapping up, Darin, any final words?
We're open for business for anybody that wants to come by and talk to us about sinus problems.
We've got the phone number, and one more time, give us your location.
We're right off of Singleton Ridge Road. The specific address is 808 Farrar Drive. We're right across from McDonald's.
Dr. Darin Sutton, you said that with a smile. Thank you so much for being with us, my friend.
Thank you.
And do not leave. When we come back, we're going to continue the conversation by talking about audiology issues, specifically the latest in hearing aids. We'll return.